As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down, I just gotta get up, yeah.
You're listening to the Tom Ficklin Show on WNHH LP 103.5 FM, your home for community radio.
Good morning, everyone. It's a kind of pleasure to kind of be here, and I have some really interesting guests. And actually, it's not the guest situation, but this is a partnership. All of my shows this year are going to be kind of highlighted as partnerships, because that's kind of the theme for me this year. It's not like the Tom Ficklin Radio Show or WNHH or even YCCI, and you'll find out what YCCI is about. Although YCCI as well is really a key partnership. But partnership's going to have to be the key, and particularly for Monday mornings at 10, you're going to hear that word mentioned more and more, but not only just mentioned, but also illustrated. What does a partnership epitomize in terms of institutions and people and the community, and actually individuals as well? The actual title of the show today, the theme, if you will, is Take Ownership of Your Health. Your health depends upon it. Take ownership of your health. Your health depends upon it. And what does that mean? It could mean a variety of things, but today we're going to particularly focus on take ownership of your health in terms of prostate cancer, clinical research, other cancers in particular. And we have some really exciting guests here with us to kind of share that information. So welcome. Stay tuned. Don't go away. It's really a pleasure to kind of talk to you. My guest this morning, we have Dr. Daniel Petrylak, and he's a professor of medicine, medical oncology, and urology, and co-leader of the Cancer Signaling Networks at Yale Cancer Center. We have Reverend Elvin Clayton, pastor of Walters Memorial Church in Bridgeport, and he's a cultural ambassador to the Yale Clinical Research Program. And you'll hear more about the cultural ambassador program. And Reverend Clayton, welcome back, because
thanks for having me back.
If memory serves, I saw you last Monday, and you left things in reasonable order and didn't destroy things, along with Reverend Perry. So it's good that you brought your Christian focus to today's a gathering. I'm going to say today's communion. And Tisha Johnson. Tisha is the Deputy Director and Chief Operating Officer of YCCI, the Yale Clinical Center for Investigation, and Associate Director for Clinical Research for the Yale School of Medicine. That's a lot, Tisha. You get, does that mean you get 2 or 3 checks?
No, just 2 or 3 jobs.
Just 2 or 3 jobs.
I'm like
okay.
Dan, just keep adding the titles on.
Okay. So Dan, let's jump in, and again, in terms of prostate cancer and what it is, and just as a point of disclosure and transparency, I'm a not a survivor, but a thriver, going through external radiation about 11 years ago. So let's talk about that, and we're going to kind of talk about what is breathe. We're going to breathe life into the fact of what does take ownership of your health mean.
So prostate cancer is an abnormal growth of certain cells within the prostate, and there are really 2 types of prostate cancer. You often may hear that men can die with prostate cancer. In fact, if you did an autopsy series on patients who are in their 80s, you'll find that there is asymptomatic prostate cancer. That's present in these patients. There's another type of prostate cancer, which is the lethal kind, that kills about 30,000 men in the United States every day. And the real question is, can we prevent this lethal type of prostate cancer from spreading? Because that's what it does. It spreads to the bone. It spreads to other organs by earlier detection. And this is something that's extremely important. It's a controversial issue. But we know that African-American men have a higher rate of prostate cancer. In fact, 1 in 7 African-American men in the United States will develop prostate cancer.
1 in 7.
1 in 7.
If 7 guys, out of 7 of my friends, it's likely that 1 or 2 of them might be subject.
Right.
That's okay.
Overall, it's about 1 in 11 patients.
Sure.
So this is...
That's right. I only have black friends. You're right. So now we go. But I have a few. So 1 in 12 of my friends.
There you go.
All right.
So, but anyway, it's a different rate in African Americans.
Yes.
It's a different degree of aggressiveness once it's diagnosed. And just to put this all in perspective, this is the 2nd leading cause of cancer death in the United States.
2nd?
For all men. So lung cancer is the 1st, and then prostate cancer is the 2nd. So it's an extremely important health problem.
And Tisha, why is this? Why are you sitting here this morning? I mean, that I know it's kind of an obscure question, but there's you're representing a lot. You're representing a lot, not only symbolically but tangibly.
So the reason that I'm here today is we're partnered with Dan and all of the faculty to make sure that we can bring not only cutting edge therapy to our patients, but also innovative clinical trials and new treatment options to test and get approval. And so today we're here because we wanted to make sure part of the cultural ambassadors, part of the message that we've been carrying for almost 10 years now is our clinical research needs to be diverse because patients who, as Dan just discussed, are impacted by disease in a disproportionate way. And so we need to make sure that the therapies in fact can be utilized, and they are. We have information about how different populations react to different therapies, and so with Dan, we're working on a specific prostate cancer study, a new drug and treatment that's sponsored by Merck, and Merck actually has given us some additional funds to promote awareness in the community and partner with the churches because they're very committed to ensuring their products and their trials have diverse participation.
You know, Tisha, thank you for kind of clarifying that. And just whenever I do a show, I kind of reflect on the importance of it to me. And part of me was, and Dan and Reverend Clayton, part of me was sad to have to do this show in 2020. I mean, it's literally sad that still, but then not like just being a personal, someone that's experienced it, but having to still beat the drum, get the word out, make sure people take advantage of it. Then another part of me said, we know it is what it is. Do what you can do when you're placed, wherever you're placed on the planet. Reverend Clayton, kind of share a thought in terms of the cultural ambassadors, because that's really important too in terms of the partnership.
Well, as cultural ambassadors, in terms of prostate cancer, all of the ambassadors that are pastors in the area had a prostate cancer awareness day. And we showed the video, and we also gave out pamphlets to make sure that not only the men, but the women as well.
Yes, that's right.
Will understand.
Yes.
The importance of our men being tested for prostate cancer. Also, on the Latino side, there is Junta Progressive Action. They had a day when they gave out turkeys, and they also shared with the community about prostate cancer awareness.
Yes, good. And Dan, may I call you Dan? I know we've just
met, absolutely.
But I'm kind of a first name person guy.
So am I.
And I know you have MDs, and actually, all jokes aside, you're literally a pioneer, and people know you in the field. And that's the blessing also of being at the station, and really in New Haven, and also at Yale. That we have people, cancer might be discovered. We may find a cure for cancer, and it could happen. It could happen here. But I'm also known as a person that has sources and information, spies out in the community. So I'm one of my sources told me that yesterday you were involved with a community effort in terms of sharing information.
Right. We were trying to share information at church in Waterbury, making sure that people understood that this is a major health problem, that in some cases, if we catch the disease early, we can potentially cure it. And then if there is a situation where the cancer has spread and it has failed standard treatment, as we're talking about with Tisha, there are other studies available and treatments available that we can use to help patients live longer, to help improve their pain, to give them a good quality of life. So it's important we get the message out.
Good. You're listening to the Tom Ficklin Show, and Dan Petrolek is here with me, MD, professor of medicine at Yale, Reverend Elvin Clayton, pastor of Walters Memorial Church, and Tisha Johnson, deputy director for YCCI. But in terms of the optimistic end, did I hear you mention, Tisha, that there's some studies, there's some interventions, there's a way of maybe abolishing. I mean, this plague. So tell us about that a little bit more.
So our center, the Yale Center for Clinical Investigation, was established at Yale to facilitate all of the clinical research we do. I think a lot of people don't understand just how much research there is going on at any given time. We have about 2,000 open clinical studies across all therapeutic areas, and even studies for healthy people. I think that a lot of people don't realize that you don't have to be sick to be a part of a clinical trial. And so at yalestudies.org, if people want to see what kind of studies are available, they're there. They're categorized and in patient language, and but partnered specifically with Dan and the Cancer Center. There are many trials that are specifically run by Dan and his team to look at these areas, and maybe Dan could elaborate on.
Please. So I think it's important to go historically as to how this is all developed.
Absolutely.
So if we go back to the early 1990s, generally a patient with prostate cancer, if it's spread to the bone or if it's spread to other areas, the standard way of treating this is to take away testosterone, which is the male sex hormone. And this has a series of side effects, which we can talk about a little bit later, but generally, it will help control the disease, but it's not going to cure it. And we can control it for about 2 years. So when I first started out in the field, nobody was working in prostate cancer. And if you failed your primary hormone therapy, you lived about a year. And there really weren't effective treatments. So through clinical trials, we developed different treatments, chemotherapy. There have been other hormone treatments that have developed in this disease. So that 1 year survival that I just mentioned is now about 3 years. It's tripled in size. And basically, we built upon this experience. So one example I used yesterday in the church was one of my patients who there's a drug called Taxotere, which was approved by the FDA in 2004. Our first study started actually in 1996. And the fourth patient was a very famous African-American activist from the 1960s who was very, very skeptical about clinical trials.
To say the least. And I understand that we don't want to mention his name, but truly, you shared the name with me before we went on air, and truly skepticism is an understatement in terms of his seminal importance to the system of oppression and how society is dealing with us.
Absolutely. And I was okay because he and I went to the same high school, so that was actually kind of a great connection. But he came into my office and he talked about an alternative medicine treatment that he wanted to do in Mexico because he didn't trust the medical establishment. And I looked at him and we talked very, very frankly. And I said, look, they're not going to tell you the truth. Make sure if you're going to go for this, be very, very careful about what you're doing because I don't want your disease getting out of control. So he went down to Mexico. He got this treatment and he was really not doing well. In fact, his leg, he started getting more and more pain, but they were telling him he was getting better. And he was actually smart enough to go back up to San Diego, draw his PSA, realize his PSA was going up. And he came back to me after that and he goes, you're absolutely right. And went on the Taxotere trials, the fourth patient treated on that. And we got him 2 years. A disease at that time where you were living barely a year. He had a good quality of life. There's an African elephant sitting on my desk in my office, carved elephant they gave me as a gift. And I'll always cherish that.
Boy, that's so
but it's important to remember that the relationship between your physician and the patient is crucial in talking about these clinical trials. You've got to establish trust. And that's one of the things I think I've been most proud of in my career.
Tremendous. Fast forward and kind of continue to lift up the optimism if someone wants to get involved. You mentioned some clinical trials. And even when you hear the word clinical, sometimes that's off-putting, but it's really helping. It's helping future generations.
Absolutely.
So, but how can people get involved, find out more, see if they're eligible, share the word, spread the word?
Well, if you're being treated for cancer, talk to your doctor, ask questions. Don't be afraid to ask questions because if your doctor is a good doctor, he or she should not be threatened by that. I always welcome other opinions and all other thoughts as to how some of these diseases are being taken care of because these diseases are complex. There's a lot of things going on as far as symptoms go, as far as their x-rays go, and as far as the overall disease management. But talk to your doctor, talk to different patient support groups. They have a lot of information. Talk to us at Yale. Just don't be ashamed to ask questions. It's not anything bad. You're responsible for your own health.
And Tisha, on the website, you referenced, the number of ongoing clinical trials, and this is 2020. This number is not going to go down, perhaps.
No, it continues to go up every year. We have physicians like Dan who actually come up with their own research ideas based on research that they've done at Yale or other teams have done. We partner in some cases with industry, as we just mentioned. Dan has one study now with Merck Pharmaceuticals, but with other pharma companies as well. And then we have a lot of trials and research activities with the NIH, the National Institutes of Health, and And so it's as I mentioned, over 2,000 studies, and it's steadily going up every year. But if you're a Yale patient, you can log into MyChart, and in your MyChart, there's a research tab, and you can build a profile and tell us more about what you'd like and how you'd like to be contacted.
But are even just the nature of the clinical trials, are those available for just the general consumer to read and find out about?
They
and
are.
share?
So if you're not a patient yet, or you don't have MyChart, you can visit yalestudies.org, and all of the available trials that are run at Yale are listed there. If you're outside of the area or you want to look at trials nationally, you can also go to clinicaltrials.gov, which is an NIH National Library of Medicine website, which has all of the trials listed, not just here in the U.S., but many international trials are listed there as well.
Of course, and that's important. Let's kind of step back for a second. I just want to elaborate and have you repeat that again, because there may always be controversy or contention or criticism or lack of trust about what does research mean. Nonetheless, it's not going to go away for economic reasons, for political reasons, for good reasons, and for bad reasons. And so, yes, you're here, and obviously you've committed your life and your career to improving things. But so it's a softball question that I want to ask. It's an easy question to ask, but it's an answer that people have to hear continually, I think. About there's risk in everything, but there's a reward in here, and it is an industry, and to get to know the people, get to know the doctors, get to know your friends might help. Get to know pastors could help with for making for limiting the skepticism, if you will.
I think many people, especially underrepresented minorities, are more skeptical because of some of the past mistrusts. And even in our partnership with the AME Zion Church in Junta, when we started 10 years ago, the pastors were quite skeptical. And the representatives from Junta were quite skeptical, worried that we in some way wanted to take advantage of the community. But I think what they found once they got the information and knowledge are really key, is that there are a lot of safeguards that are put in place now. Things have changed. And although there have been these terrible incidences in the past, what happened is the regulations have changed. We've changed. We've evolved. And so through our partnership with the cultural ambassadors, we've spent almost 10 years together trying to make sure that the community has the information and has the knowledge and has the options. Yes. I think that that's really the key, that without the information, you don't have access sometimes to the most cutting edge new information, new research therapies. There are just options to consider. Like Dan said, the most important thing to do is talk to your doctor and understand what your options are, get all of the information, and then make a decision.
Reverend Clayton, any thoughts in that regard?
Yes,
because I know you and I believe Reverend Perry, you mentioned you were down in New Orleans, not somewhere in Louisiana 2 weeks ago.
Yes, let me just continue here just a bit. The mistrust factor, I believe it is improving because of the Cultural Ambassadors Program and because Yale has done so many things in the community to let it be known to the minority community. There's an area where now have people who are prostate cancer survivors,
thrivers,
and their testimonies, is a powerful tool for those in our community who were lacking trust. So, with those things progressively moving forward, we've noticed that people feel more comfortable asking questions to the ambassadors. And as Tisha and Dan spoke earlier, that of course they should always speak to the doctor, but when you talk to someone that you know,
the familiarity,
your neighbor, your uncle, your friend, it raises the level of trust and comfort.
Excellent. Dan?
Yeah, I mean, there was follow the golfer Phil Mickelson on my Twitter page. There was actually a very, very interesting little tweet that he put out recently. He said, if you have a loved one that has cancer, number one, say what you have to say, even though they may not like it. And then number two, always get another opinion, because there's a lot of misdiagnosis and a lot of misinformation out in the community. So I think it's really important to communicate, ask questions. The consent process that we go through for these clinical trials. It's quite extensive. And I know when we hand the consent form over to the patient, it's quite daunting. In fact, I often joke that if we wrote up a consent form for aspirin, you'd never want to take an aspirin for the rest of your life. But, again, I think that we have many people involved in the consenting process and also in monitoring the patient when they're on studies. This is very, very crucial. Communication between the staff of the physician and the patient, and making just simply the patient knowing that the physician's there, even though he's got this group of people in front of him, is really, really crucial.
Should we talk a little bit, guys, about the Merck trial, or just how invasive it might be, how easy it might be? Just people sometimes don't have a knowledge base of even what to imagine if they want to participate or share the information with someone.
So there are two Merck trials that we're talking about. One is building upon the results that we did with chemotherapy with Taxotere that I mentioned before. And the theory behind this is that giving immune treatment, a drug called Keytruda, which is FDA approved for a number of different cancers, including lung cancer and bladder cancer, that by giving this along with chemotherapy, that we may actually get a better effect in patients. And we've actually done some preliminary studies with this particular drug in the past with prostate cancer. So it looks very, very promising. But this is an international study, and we're trying to determine whether this is going to make patients live long. The other trial is doing something very, very similar with a hormonal agent called enzalutamide. So these are randomized studies. Patients are getting at least what we consider to be standard of care, and they're either getting drug A plus the standard of care, Keytruda plus the standard of care versus the standard of care alone.
How critical? Just when you mentioned if I'm asking obvious questions, is because again, I used to pride myself. I still pride myself somewhat on being a quick learner, but sometimes information I just don't digest as quickly as I can. But when you say international, how important is it to have people that are participating from the Caribbean, from Africa, from?
It's crucial.
Okay.
And so if we look at the clinical trials in prostate cancer for the last 15 years, when you calculate out the number of African Americans that should be participating based upon the overall demographics of the population, it should be 12%. So there was a recent study in the Journal of Clinical Oncology that showed it's only 6%. And so the real question is the disease different in these patients? Does it behave differently? It's more aggressive, but some data that I have and some data that other people has as well shows that for chemotherapy, for immune therapy, African Americans actually do better. They have a better outcome. So why? Why is this question? And is this real? Because it's a small number of patients. So are we selecting our patients that go into these trials? And then how do we then counsel our patients later on when we talk about these treatments as well? That's why it's so important for us to have a diverse group of patients participating in our studies.
And Tisha, I see your eyes light up a little bit because you've been, how long have you been at YCCI?
Since the beginning, since it was founded in 2005.
When you're babies, and I don't necessarily talk about bios as much during the show, but just name drop a little bit. You had a stellar career. I looked at your bio prior to coming here to New Haven. So let's.
I was also at the University of Wisconsin-Madison as the director of clinical trials there, and I was assistant dean at the University of Vermont College of Medicine for clinical trials. And prior to that, I was actually in biotech. So I've been doing research for quite some time now.
So elaborate on that. I hear a 15 to 20 year experience already, and seeing the political ups and downs, the economic ups and downs, the rip-offs, the scams, the fruits of people's labor, just the controversy about medical and healthcare in terms of all populations. Where are you today in 2020 looking forward about what? Are you optimistic about things? Do you see the challenges?
I'm very optimistic. In addition to the partnership that we have with the cultural ambassadors, we formed a partnership with the FDA, the Office of Minority Health and Health Equity, and we're focused together on this issue of diversity in clinical trials. It's been one that we've been partnered here in New Haven for the past 10 years, and we've seen a huge difference. When we first started this partnership, most of our trials, as with most of the national academic centers, have 2 to 4% participation by all underrepresented populations. Last year, we had a record year of people participating in our clinical research studies. Almost 27,000 people participated in studies. and 30% were from underrepresented populations. And this year, 30%. We're very proud of that.
Boy.
And this year, it looks like we're going to be closer to 32% in another high year. So we're very excited. We don't think that would have been possible with all of the education, with the ambassadors actually spreading the word of trust and trying to break down some of the myths and barriers to people participating in clinical research. And a lot of it has also been the ambassadors educating us.
And Reverend Clayton, correct me if I'm wrong, and Tisha as well, but I believe you've referenced the training. You don't just say I want to become a cultural ambassador and get stamped with that credential the next day. There's a little bit of a boot camp or training
it's
involved.
Over 100 hours of training, and it's ongoing. And as a matter of fact, what Yale has done with our Cultural Ambassadors program, it looks so great that we've partnered with Duke University in North Carolina. They wanted to have a program that would model ours. So we see that it's not only growing here in New Haven, but it's growing elsewhere as well.
And that gives you the excuse for going down to Louisiana as well, I'm told.
That's a good excuse.
Well, but it wasn't during Mardi Gras, so you got to go back in a few weeks.
No, sir.
I'm sure you'll find other places. Dan, what keeps you optimistic about moving? Because again, you've committed. You and I. I'm not sure how old you are. I'm not going to put you on blast here during the show. but you've been involved with this issue for a while. Where's your optimism spring from?
My optimism springs from the fact that right now we're seeing a convergence of clinical medicine, translational medicine, or science, and we're seeing so many new treatments moving forward. I mean, one of the other tumors I take care of is metastatic bladder cancer. When I got to Yale in 2012, there were really no treatments available for patients once they failed their primary chemotherapy. They lived about 6 months. Since that time, we've developed immune treatments for bladder cancer. We were instrumental in developing a new smart bomb for patients who failed.
Smart bomb?
Smart bomb. It's actually it's a drug that basically targets bladder cancer cells and delivers chemotherapy directly to the cells. It's a drug called enfortumab. It was just approved by the FDA about 3 weeks ago. And so now, in a disease where we had a survival about 3 months, we're closing in on about a year. And this is for all patients. So we're really beginning to use the science that we've learned and the biology to develop newer treatments. It's a very exciting time.
And you're involved with testicular cancer as well?
Yes,
I mean, I practiced saying testicular like for 4 days, so I got to kind of get that word out. Testicular. I mean, that's a tongue twister.
It's a tongue twister. There are a lot of tongue twisters in medicine. A lot of names for the same thing. Now, testicular cancer is a curable cancer, and usually young men. But more than 90% of the patients, if they are diagnosed with it, are cured. Think back to the 1960s. That wasn't true. In fact, the movie Brian Song about the football player Brian Piccolo. Brian Piccolo had metastatic testicular cancer. He died from that. And perhaps had he lived in a different era, he would have lived. But again, we're seeing new drugs, new treatments that are moving forward that are helping patients.
And again, you're listening to the Tom Ficklin Show, and hopefully you can. We've been able to communicate, and we have about another 20 minutes by the theme of the show, and take ownership of your health. Your health depends upon it. Take ownership of your health. Your health depends upon it. Why that theme is just really important for the new year, that you can have some agency, you can have some direction and power and authority over your destiny, but you got to collaborate. You got to find partnerships. You got to also seek trust and get valid information. And that's why I really love what you guys are up to in terms of the validity of information, research studies, et cetera. Say a little bit more about that, Tisha.
Yeah, one of the most important things when we started the Cultural Ambassadors, we actually had done multiple focus groups. And in all of the focus groups, what we found were the minority participants just said, there's no way I would ever participate in clinical research. I don't want to be a guinea pig. Not really understanding what that meant or anything behind it. And so we decided to dig deeper. And as we dug deeper, one of the myths, as an example for cancer studies, was people thought if they participated in a cancer clinical trial that they actually wouldn't get cancer medicine. And that's just not true. And so I think that those are the kinds of important misperceptions that the ambassadors have helped us correct, because they are a trusted voice in the community. They're able to talk about all of these issues. They're able to, as Reverend Clayton said they're able to have the knowledge themselves and pass it on. And so I think those have been really important lessons as part of this process, to really get the information out to the community, to explain to them their rights, to explain to them the protections, to explain the right questions even to ask when they go in and they're thinking about a clinical trial, so they can have the information to consider. And those have been really important efforts for us. And
I really appreciate your saying that. As we know, we're broadcasting on Martin Luther King Day. And if you read about Martin Luther King Jr. and the Poor People's March, which did take place, he was assassinated before, but it still went on. And but he talked about bringing, if you need some health care, come to Washington and actually go to the hospital. If you don't get care, just sit down and kind of civic action. So, and he's made other statements about during that time regarding the injustice of the healthcare system at that time. So it's when we talked about having the show this morning on MLK Day, I said this works. This is not just, I mean, celebrations are fine today, speeches are fine, but sharing information about how you can, certainly people can take ownership of their own health and be more free and not less free. Dan?
I completely agree with that.
Well, and just again, I recognize and respect the fact that we can't mention the person's name that you treated. And this was back in 77.
In the 90s.
In the 90s, shortly before. And so, but this person, if you're into if the word Black Power has any resonance, this person was kind of very much involved with the creation of that term. So you've been involved for a while.
Yes,
long time. And a little bit on your background. What was the inspiration? When did you want to become a doctor?
Well, I worked in a laboratory. I started when I was 16 years old.
16 years old.
And I had a mentor who basically was using actually protozoa to model cancer drugs, and that always had a huge influence on me. And then I did my residency and internship, and when I did my fellowship, one of my mentors, a gentleman named Alan Yagoda, who since unfortunately has passed, but he would say to me, nobody's working on prostate cancer, work on that disease. And this was in the 90s as well, or actually late 80s. So I took that to heart. And one of the things I've always tried to do in my career is work in places where people weren't working, because that's where the missed ideas and the interesting ideas
the need,
are.
Sure.
So that's how I got started.
Well, and the rest continues. So
absolutely.
When people characterize you, I'm gonna pick on you just for a few more seconds.
Great.
As being a pioneer in the field, does your hubris kick in? Do you agree with it?
Well, it's a team effort.
Okay.
I think that's the important thing to remember. And I have the best team right now I've ever had.
You can name drop a little bit.
I've got I've got a wonderful project manager, Matt Piscatelli. Shelby DiCarlio is one of my research nurses, and Ebony Williams also. We've had great nurse practitioners that have worked with us in the past. A woman named Kristen Crowley has done great work with us. So we had some great people, and you're only as good as the people that you work with, and we all synergize, and that's the important thing. And it's important to listen to what your staff members are telling you, because they're the eyes and ears. They've got their heads close to the ground, and they're really really helpful in telling me things that I may not notice.
We have about another 8 or 9 minutes, and Tisha and Reverend Clayton, if people want to find out more about cultural ambassadors, find out more about the activities, but I know you have some upcoming events. I'm not sure if that's for public dissemination.
So I'll let Reverend Clayton speak. We have multiple events coming up partnered with the cultural ambassadors. We also have an Innovation and Diversity Summit coming up on February 28th. We're partnered with the FDA. It's going to be a wonderful event. Peter Marks from the FDA, he's the director of the Center for Biologics and Evaluation, will be there, as well as Gary Gibbons, who is the director of NHLBI, Heart, Lung, and Blood Institute at NIH, are going to be the keynotes, as well as many other members from the FDA. And some of the folks at Yale, as well as our cultural ambassadors, are going to present. And the whole day is really going to be focused on talking about this issue of diversity in clinical trials. And so we're very excited. It'll be hosted here at Yale at Harkness Auditorium, and it is open to the public. And so if you go to our website and look under the events, section, you can go there and register for the event.
And what time does it start, roughly?
It starts about 8 o'clock in the morning. It's nice and early.
Which is later than last year's event.
Yeah, later than last year's event.
Last year's event started at 7:30.
It did start early.
I'm just saying, I kind of remember. Yeah, I kind of remember. But let's, all jokes aside, last year's event was seminal in terms of the participation, and people may not know when you mention Henrietta's name, et cetera, but Google, but share us a little bit about last year's as well, because I think that'll help people to realize that some ways that we can be sad, but in other ways optimism is still a better choice.
Yeah, last year's event was our first event. So this was always planned with the FDA as part of our partnership, the Office of Minority Health and Health Equity as a part of our partnership to have an annual event focused on diversity in clinical trials. So last year was our first. We invited members of the Henrietta Lacks family. Everyone probably has read the book or seen the movie.
Indeed.
And so,
but they have the family there.
They have to have the family talking about their experience, talking about first the hurt and the pain of understanding that their relative, one was her great-granddaughter, had been taken advantage of and in this way and never really consented for clinical research, and even the issues with the family and the release of her genome, but moving beyond it to understand what actually has changed in regulation as a result of those things. And so this year's event, we're excited. We're actually going to continue to talk about the issue, but we've invited the leadership from NHLBI and FDA to talk about their initiatives. And we'll also have the person, one of the people coming who's going to talk about all of the statistics that the FDA gathers around diversity in clinical trials.
Excellent. And again, it's on Friday, February 28th, and people can find out more information by going where?
If they go to the Yale Center for Clinical Investigation website, it's right under news and events.
Excellent. And starts at 8 o'clock.
Starts at 8 o'clock.
Go to sleep early the night before. Reverend Clayton, what's cooking in your brain? We were talking a little bit about the Bible and how health is kind of permeates the Bible. People might, even if you're an agnostic, if you read the Bible, you're going to there's diets are in there, menus are in there, what one should eat, what one shouldn't eat, just healthy thoughts. So any theological ruminations you'd like to share?
I want to go back to the topic of today's show.
Okay.
Take ownership of your health. So many men take ownership of so many things, but neglect their health.
That's right.
God only given us one body, and we need to take care of it. So as we move forward, I'm pleading with the brothers to
indeed
to get your annual physical checkup, and don't be afraid to be checked for prostate cancer. You hear things out of the mouth of some brothers that I don't want to go because if I go, I know I'll have it. But if you go and you discover that you have it, there's so much that can be done for you today.
Yes.
Dan spoke to us so wonderfully about the new technology that will help us and help you to live longer. And if you get tested early enough, there's a 90% chance of survival.
Correct. I mean, I know he's a reverend doctor, but you're a real doctor.
That's right. No, that's correct. That's correct.
Just want to get confirmation.
If 90% of patients diagnosed with prostate cancer will survive 5 years. But it's identifying that group that has the aggressive disease that you need to really treat very, very aggressively.
Very correct. Okay. And so we hear this term. We don't want to get into we don't have time to get into a very technical examination, but PSA is a common. So that is, what is PSA?
So PSA is something called prostate-specific antigen. It's a protein that's made by the prostate and goes into the bloodstream. And it's a simple blood test. And if your PSA is less than 4, you have a good chance of not having prostate cancer. Although there are some who argue that cut point should be 2.5. But nonetheless, if it's high or it's elevated, then you need to discuss with your doctor what to do next. Should you have a biopsy? Should you have an MRI of your prostate? There are a number of different things that occur. So it's controversial as to whether PSA improves survival. There was a study a number of years ago that basically gave, or was from the United States Preventative Task Force that gave prostate cancer screening a D level, which means don't do it. But then when that started, we started seeing an increase in the amount of metastatic disease. So they've actually retrenched from that and have given it a C, which means discuss it with your physician, which is really what you should be doing. And doing a PSA test, there's a lot more to it than just simply drawing. You have to assess the patient. Are they somebody who's elderly who may not benefit from prostate cancer treatment? Are they a young patient with a family history? So there's a lot that goes into, a lot of thought that goes into this.
For the prevention standpoint, is there anything we can talk about how people can increase their chances for not getting it?
Well, I mean, there's some thought that by being on a low-fat diet, a non-Western diet, that may actually help. In fact, if you look at the prostate cancer rates in China, Japan, they're very, very low. When you have somebody who emigrates from China or Japan to a Western country, they then assume the same risk of prostate cancer.
McDonald's takes over it.
It may be that. But from we often joke that a heart-healthy diet's a prostate-healthy diet. And just keeping the saturated fats down low, I think, just from a general health standpoint.
Good. Tisha?
So I think the big thing as you've, the theme of the show, take ownership of your health, is just get the information, speak to your doctor, understand not only your treatment options, but understand how clinical research might play a role. And even if it won't help you, the idea that the knowledge gained, actually, it might help your children or your grandchildren and help us find cures for the diseases that are disproportionately impacting our populations.
Definitely. We have about 2 minutes, so I want to give everybody the last word. And I guess I really enjoyed Dr. Daniel Petrolak and Tisha Johnson and Reverend Clayton being here with us, because this is important. This is important any day of the year, but particularly on MLK Day. There's just so many ways we can, I think, epitomize his spirit and his sacrifice and where we are and what that means to us. And you, yourself, your family, your job, wherever you're listening to this show, what it means. Kind of take that deep reflective dive and being proactive. And health can be defined in a variety of ways in terms of body, mind, spirit. But however you want to define your health, it's important. And they're important. There are partners out here. There are allies out here that can assist. So I just wanted to kind of thank all three of you for being here, and want to give you the last word, and you take your time in sharing what thoughts you might have. But it's important for us to hold hands and come together and kind of consider that we may not be we're maybe one race, two races, three races, but nonetheless we have a lot in common. We have a lot in common. Tisha, any final last words?
For us, it's more than just one day. It's getting the information out. The Center for Clinical Investigations, we're supported by the School of Medicine and Yale New Haven Health System, and Yale Medicine as our clinical partners. And just making sure that you're getting information from a trustworthy source. Even if you have doubts, just gather all of the information, speak to people, and understand what your options are. But be screened and take control of your own health.
Absolutely. Dan?
I agree completely. I mean, what you said before, we're all Americans, and we all love each other, and we all take care of each other. And that's, I think, the important thing to remember, that's what we're here for.
So you're going to vote, you'll be in the impeachment hearings, you're going to be a senator, and you'll
I'm just a physician.
Convey that to people as we speak. I'm sorry, I didn't mean to redefine your opening your closing statement. Do you want to give it again?
No, I think
I'll be quiet.
We're all. This country is just, there's so many great things about
indeed
healthcare that we have that other countries don't have.
Yes.
And I've seen that by traveling the entire world, and again, we're all trying to improve everybody's health and everybody's welfare, and that's the important thing to remember.
Perfect.
One big community.
Perfect. Dan, Reverend Clayton?
Yes, Tom. Dr. King did so much for our country, sacrificed so much. And we have an opportunity now to help so many people get their health in a positive way.
Yes.
And if you want to find out more about the clinical trials, just visit us at our website, yalestudies.org.
Excellent. Everyone, thank you so much. I mean, it's been a pleasure, and we'll see you again. And again, this is the Tom Ficklin Radio Show, and just glad to have the partnership. Harry, thank you for your engineering as always. Thank Paul Bass for being the Moses of WNHH. Paul was involved with starting the New Haven Independent, and I really respect his understanding that media is certainly power. And here in New Haven, we're blessed to have so many resources available to us. Thank you, everyone.
Thank you.
Thank you.
Looking at the void in myself and feeling what's missing. Better watch the way you going. Better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down out of the sky.